Due to the increasing growth in the number of individuals aged 65 and above, the need for personal assistance services has grown exponentially over the years. Personal assistance services provide quality, non-medical home care services to seniors in the comfort of their own homes through professional, individualized care that helps extend and enhance dignified living at home as a safe and comfortable alternative to institutional living. Services are geared towards achieving the highest level of comfort, independence, dignity, and choice for seniors, without the stress of interrupted routines and changes in their daily habits. Whether you're just starting out or looking to strengthen your existing operations, this video is packed with actionable strategies and business insights designed specifically for the home care industry. Have a business plan. This gives you a clear understanding of the business before making a commitment. Consider it a roadmap to success. Before working on your business plan, do all the necessary research and be sure and confident that this is an area that you can passionately grow in. Learn all the possible challenges and success of operating a home care business. Talk to other business owners. Join home care groups on social media. It is very important to go in with the right mindset. Home care business, like any other business, is not for everyone. It requires dedication, compassion, networking, and hard work, especially in the beginning. Mission. Have a strong and meaningful mission. It can sound something like this. The mission of our company is to offer quality of life by preserving personal freedom, independence, privacy, and dignity in years of declining abilities and health, and to ensure provision of the best quality of care in the industry. In order to succeed, the agency plans to make our client services our #1 priority. We will stay abreast of trends in the home care industry, assess the client needs, create a safe, supportive, and engaging experience for our clients, and then exceed their expectations. Know your business goals? Here are a few examples. Our business goal is to offer high-quality personal assistance services at a competitive price, focus on quality controls and ongoing operational excellence, recruit caregivers and have them carefully selected, screened, trained, and supervised for utmost best care, create a marketing campaign with a consistent look and message. Core value statement. How will your agency fulfill its mission? Here are some of the ways to word it. We will fulfill our mission through our commitment to being respectful and ethical to our clients and employees, honesty and integrity in all areas of our professional relationships, performing tasks on time to satisfy the needs of our clients and by being an active part in the organization and in the community, personal and professional improvement through continuous education and training, offering professional treatment to our clients, employees, and the community, loyalty to the team, and dedication to achieving our mission and goals through teamwork. Be clear about the services you will offer. Example, respite care services, companionship services, housekeeping errand services, Alzheimer's and dementia care services, check-in services. Know your target market. Your target marketing strategy will involve identifying a group of clients to which to direct your services. Your strategy will be the result of intently listening to and understanding your target client needs. Have a marketing strategy. Here are some examples of promotional marketing strategies: business cards, website, health fairs, email, referral programs, vehicle wraps, social media, flyers, direct mail, doorknob hangers, brochures, newspaper ads, testimonials, wearables such as t-shirts, pens, and cups. Your agency should target the following: referral sources, such as hospitals, residential care facilities, nursing homes, assisted living facilities, senior residences, social workers, discharge planners, realtors, adult daycare centers, geriatricians, veterans, pharmacists, and attorneys. Strategic marketing alliances such as family doctors, mental health centers, rehabilitation centers, hospices, churches, moving companies, medical equipment providers, and therapy services. Competitors. Your competitors may have a client they are not able to staff due to staff shortage or distance. You can also apply the following techniques to improve customer retention. Use only well-trained personal care assistants and perform ongoing training and competency evaluations. Carry out performance improvement surveys sent out to your clients for feedback, and promptly act upon their inputs. Respond to client complaints promptly. Let your customers know how much you appreciate their business. Practice good phone etiquette. Publish customer reviews. Develop and publish a list of frequently asked questions. Hold informational workshops and seminars. Competition. Offer competitive prices and high-quality client-focused services. Maintain an excellent reputation for trustworthiness and integrity with the community you serve. Make your services unique, giving you a competitive advantage by making your agency stand out over other agencies. To be better than your competitors, service your client needs with personalized attention and expert knowledge. Launch a website to showcase your services and customer testimonials, involve the local community, and create business partnerships. Conduct a targeted and cost-effective marketing campaign that seeks to differentiate your caregiving services. Share profits among employees through incentives to reduce employee turnover and improve productivity. Recruit screened employees with a passion for delivering exceptional care. Institute and employee training to ensure the best care techniques are consistently practiced. Network aggressively within the community, as word of mouth will be your most powerful advertising asset. Maintain a highly regarded reputation for excellence in caregiving and community involvement. Offer competitive pricing. Develop and maintain referral relationships with other care providers in the area. Have all policies and procedures in place before beginning operations so that there are no delays in offering quality services to your clients. Before making any sales presentation, anticipate tough questions and practice the answers. Develop ways to stay in touch with potential clients. Outsource management functions that you do not have the time or skills to handle properly. Keep searching for ways to improve the client's quality of life. Ensure proper licensing and liability protection. The business should consider acquiring the following types of insurances: trust and bonding insurance, state unemployment insurance, workman's compensation, liability insurance, health insurance, auto insurance, malpractice insurance. To help save on insurance costs and claims, do the following. Stress employee safety in the employee handbook and carry out employee safety training and drills. Screen employees with interview questionnaires and perform pre-employment drug tests and comprehensive background checks. Limit the responsibilities that the agency chooses to accept in their contracts. Establish loss prevention programs to reduce the hazards that cause losses. Require certificate of insurance from subcontractors. Investigate accidents and put in place preventive measures that prevent incidents from reoccurring. Adopt health-specific changes to the workplace, such as adopting a no-smoking policy at the workplace. Identify potential risks early and how to overcome them. Identify the agency's strengths. What services are we best at providing? Example: an experienced management team, strong networking relationships, excellent and experienced staff to ensure your clients are receiving the utmost best care, high customer loyalty, development of established best practices, offering personalized service and care, competitive pricing. Identify the agency's weaknesses. In what areas could the agency improve? Examples: is there lack of marketing experience, a limited marketing budget to develop brand awareness? Is the agency finding it hard to find dependable and people-oriented staff? Is the agency facing the challenge of establishing itself in the community to gain trust? Is the market highly competitive? Recognize and act on opportunities for growth. What opportunities are there for new and/or improved services? Example: spot gaps in the local market that your agency can fill. Build relationships with hospitals, rehab centers, and physician offices. Monitor your agency's performance and client feedback for improvement opportunities. Leverage your existing client base to offer additional services. Stay informed on regulatory and payer changes that may open doors to new revenue streams. Establish referral relationships with local businesses serving the same target market segment. Network with non-profit organizations. Publish testimonials. Offer satisfaction money-back guarantee. Implement consistent marketing image and performance. Get recognized certifications. Conduct responsive customer service. Accept installment payments. Make available prior customer ratings and comments. Become a Better Business Bureau member. Document procedures for dispute. Identify your operating revenue sources such as Medicaid waiver programs, private pay, Veterans Administration, long-term care insurance plans, managed care programs, workers' compensation. Break-even analysis. Determine how much revenue you need to cover your operating costs so you know exactly when your business moves from surviving to thriving. Learn how to factor in labor costs, overhead, and billable hours so you can price your services confidently, plan for growth, and avoid financial surprises. Projected profit and loss. Map out the financial future of your home care business. This helps you anticipate how much income your agency is likely to bring in, what your expenses will be, and ultimately what your profit margin could look like over time. Learn how to estimate your monthly and annual revenue based on billable hours, average client load, and payer mix. Calculate your fixed costs like rent, insurance, and admin salaries. Track variable expenses such as caregiver wages, mileage reimbursements, and supplies. Project net profit or loss month by month to identify trends, goals, and decision points. Have great policies and procedures in place to ensure there are clear lines of authority, responsibility, and accountability in the administration and delivery of agency services in the community. These written guidelines define how your agency operates on a day-to-day basis, ensuring consistency, safety, and accountability across your entire team. Make sure that the administrator and alternate administrator are able to assume the responsibility of implementing and supervising the administrative policies and operations of the agency, and administratively supervise the provision of all services to agency clients. Have a great disaster coordinator to provide oversight of compliance with the agency's policies and procedures relating to emergency preparedness and response planning per federal and state regulations. Hire a great supervisor of personal assistance services program to supervise attendant services and monitor appropriate staffing and productivity. Coordinate care with the interdisciplinary team, client, family, and referring agencies. Monitor and analyze QI issues and direct staff with regard to agency policies and procedures. Hire compassionate personal care attendants to assist with activities of daily living, personal care, and provide a clean and safe environment at the client's place of residence, as outlined in the client's individualized service plan. Work cooperatively with the client and the client's family, reporting all undue findings and observations to the supervisor. Have a plan in place for ongoing staff evaluations and training. Having a structured plan for ongoing staff evaluations and training is essential to ensure the delivery of high quality, compliant, and patient-centered care. Regular evaluations help identify strengths and areas for improvement in performance, while continuous training keeps staff up to date with the latest best practices, regulatory changes, and safety protocols. Stay on top of licenses renewal dates to avoid fines, unplanned surveys, closures. In the home care business, staying on top of license renewal dates is critical to maintaining uninterrupted operations and regulatory compliance. Missing renewal deadlines for agency licenses, staff certifications, or required permits can lead to costly fines, unplanned surveys, or even temporary or permanent closures, all of which can damage your agency's reputation and disrupt patient care. Implementing a reliable tracking system or calendar reminder process helps ensure that renewals are completed on time and that supporting documentation is kept current and easily accessible. Have all the required administrative files in place for your state. Having all required administrative files in place for your specific state regulations is a foundational aspect of compliance and operational stability. Establish a well-maintained filing system, whether digital or physical, to ensure your agency is always prepared to demonstrate compliance and meet regulatory expectations. Always be survey ready by consistently doing things right. Always operate as if a survey could happen at any time. This mindset means consistently doing things right. By embedding regulatory standards into daily routines, agencies not only reduce the risk of citations, but also foster a culture of quality and accountability. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you, and feel free to share this with anyone who might find it useful. See you in the next video.